Hi there, my name's Jay, and I recently had eye laser surgery. And the reason I'm making this video is I really depended on YouTube videos to help me with my decision, as well as a number of other people. But I just wanted to tell my story and just maybe put to rest some of the concerns that other patients may have. So first of all, I'm a little over 50, okay, 56. Bottom line is I've worn eyeglasses and contact lenses all my life. It's not that I can't bear with them, but I just found them to be a real pain. I learned to dive, I think it was about 10, 11 years ago, and what a pain to have to put in my contact lenses because, you know, wearing glasses underwater just doesn't cut it. I found with my contact lenses, like within 6 to 8 hours, sometimes less, they get all dried out. There's been times when I was driving late at night with my contacts in, so for maybe 10, 11 hours, I can barely see. So I swear it was to the point that it was starting to cause, you know, potential accidents because I was constantly blinking my eyes, trying to get a little moisture in them. But anyways, I've been thinking about this for about 3 years. I went to a PRK laser specialist, then I went to a Lasik specialist. This was 2.5, 3 years ago. I still wasn't convinced, and I admit it was the stories that I seen online from people committing suicide to grandmas that are going to never see their children, none of which happened to me. I guess unfortunately, I'm guessing there's a small percentage that did it. But anyways, the final convincer to me was two of my staff had the procedure. One is a young lady, she's only 26 years old right now, but she had PRK about 6 years ago. And then another staff member, Candace, that has had it about 8 years ago, and she had the Lasik. Now in my case, it wasn't Lasik, it's similar though, but it's called Intralase SBK, and it was the London Eye Centre in Vancouver that did it. So I'm just going to share my experience. So once I finally decided that I was going to do it, this is my experience. So I booked the initial consultation and decided that if my eyes were suitable to go ahead with the Intralase, that I was just going to go ahead right after the appointment. The PRK, I still might have done it, but I'm still a little bit leery of that because it takes much longer to heal than the Intralase SBK. So anyways, I begged my wife to come with me. We live on Vancouver Island, and I just wanted that extra surety. I admit I was nervous. Went in for the appointment, and they said that I could choose any of their two procedures. I decided to go with the less painful one, which is the Intralase SBK. And within an hour after my appointment, they had me in, and they started to put all these eye drops that numb my eyes. And in my case, there's actually two lasers that you have to work with. So the first one cuts the part of the eye, I guess, the flap, and then it's open, and then they whip you over to another laser, and then all you can see is just black and all of these weird lights and stuff like that. But I promise you, it's absolutely painless. I'd get this surgery over again versus having to get a root canal or something like that. It is not painful at all. It was like 2 minutes per eye. It was amazingly fast. After that, stayed in the recovery room for, I don't know, maybe half an hour, maybe a little bit more. And then we were out of there, booked into my hotel. And because when you get the surgery, you have to see a doctor the following day just to make sure everything works out. And anyways, I was out for dinner with my son and that evening, and his wife and baby, my granddaughter. And anyways, it was just awesome. Now, I admit that all the stuff that was scaring me was all of these halos and all this kind of stuff. And you know, I do admit that I can still see a little bit of starbursts. For the first week or two, it was a little bit intimidating to drive at night because it was kind of a collage of starbursts. I haven't necessarily seen halos, but I did see starbursts. But it has not affected my driving. It's getting better every day. It's been almost 2 months in now, so it hasn't been that long, so there's still time to repair. And it takes, I guess, up to 6 months of follow-ups to make sure that everything goes well. In my case, especially at my age, at the age of 40, even with my contact lenses, I still had to wear reading glasses. So I chose to get 2015. And I'm really, really, really glad I did that. So I know it's weird, but one eye can see far, one can see close. But it means that I do not have to rely on on any eyeglasses whatsoever in order to read stuff. And we went to this kind of this dancing competition on the weekend, and I noticed a lot of people similar to my age, and the mass majority of them were constantly having to put on reading glasses to read the various different performers, the menu, and all this kind of stuff. And I have to admit, I sat back and felt very, very pleased that I had done this. And again, the icing on the cake is not having to use my reading glasses. And it's just amazing. I can read like the teeniest fonts from quite a distance, and it still amazes me today. And the other thing, it really improves your vision. I know they sound like simple little things, but when you've worn glasses and contacts all your life, you don't see these things. But I'm just sitting in my backyard and I'm looking down at this small little bit of grass, and the things that I could see, the amount of bugs and ants and earwigs and all this kind of stuff in just a small amount of space. I could never ever see that. And I go in, I'm saying to my wife, "Oh my God, did you see all this stuff?" And it was absolutely amazing with the clarity of vision. A couple of weeks ago, I was out at this ocean inlet, and there were some eagles that were downing. They were probably, 300-400 feet away or something like that, and they were diving for fish and stuff like that. And it was just absolutely amazing. I could see everything absolutely perfectly. I even seen a sea otter like way, way, way off in the distance. So anyways, I just wanted to share this. I was constantly looking for what you call positive YouTube reviews on eye laser surgery, and for me, it was just 100% worth it. Just no comparison at all to having to wear glasses. I still constantly feel when I get up, I grab my glasses at my night table, or I'm constantly feeling as if I've got some contacts in my eyes, or felt like, I've got to pull up my contacts because my eyes are going to dry out. None of that happened. Now on that note, with dryness, I did not have dryness. Maybe for the first week you're supposed to put extra drops and stuff like that to help with the healing and all this kind of stuff. I followed that. But after that, even now, I haven't put in any moisturizing drops for I don't know how long. So this was another concern, was some people seem to have a lot of permanent dry eye. I did not have that at all. So anyways, I just wanted to say that if you're considering eye laser surgery from a bit of an older guy, I absolutely feel absolutely confident in recommending it. Do make sure to do your research on the doctors. I did the same thing. I took the name of the surgeons and I looked for reviews to make sure that everything was satisfied, and I was going to choose this particular doctor. And anyways, no, I don't work for London Eye Center, but anyways, I was very, very, very happy with them, and I definitely highly recommend them and or other practices that have good records. Now, some people say, well, what did you pay? I don't mind saying it was $3,800. Some people say, gosh, you could have done it for less. I don't know. When you're dealing with your eyes, price really wasn't my motivation. I didn't want to go for a $1,500 surgery and risk the complications. So these doctors have been around for like 30 years or something like that. I felt very, very, very comfortable with them. The nurses, all the patient coordinators, everything was A+, and anyways, I was very happy. So hopefully if this helps you with your decision, if you're on the fence, and take it from me, I would highly recommend it, and I hope this helps some other people that are thinking about the procedure. Thank you.